This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Krystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. Thanks for joining us for this latest edition of Mon Health Live. We will come to you each Saturday morning at 10 o'clock with the latest on this COVID-19 pandemic. The information you need to know will get you the latest on vaccine updates and everything that's going on with this health crisis as it relates to the Mon Healthcare Systems. David Goldberg, Chief Executive Officer of Mon Health Systems, will join us, as will Dr. Krystal Atkinson, Chief Nursing Executive of Mon Health Systems. They're our co-hosts for the show today. We'll hear from them in just a couple of moments, but we're going to start with Dr. Bradford Warden. Dr. Warden is Executive Director of Mon Health System Heart and Vascular Service Line, and he's the Chief of Cardiology. So what do heart patients need to know during this health crisis? And one of the things is a lot of people have put off health care. They're a little bit concerned about seeing doctors or going to hospitals. And doctor, what would you say to that?
American Heart Association was saying, they certainly believe in social distancing, but people have to stop medical distancing. It's just critical that people get in to the clinics, and there are options there. There's coming into the clinic physically. We have expedited. There's not really a check-in process. You move right into a room by yourself. You're not sitting with a group of people. The room's been just cleaned before you've come into it. The doctors, nurses, and medical assistants are all wearing masks. They're all wearing eye protection. They are screened every day for fevers. They're asked questions, so forth. So all the providers, everybody working in the clinic has to come through this check-in process. And cleaning has really been pushed to the recommendations of the CDC. So it's a clean environment for you to come into. And then, like I said, if you decide to come into the clinic. If not, we have telemedicine, which is great. And sometimes if people don't have access to a computer, it can just be a telephone call. But we can help with adjusting medications for high blood pressure, for cholesterol, and those sorts of less urgent situations, so that he can take care of patients even during a pandemic.
We've heard about the comorbidities and how people with the comorbidities are more susceptible to COVID-19. Is that the case? If you have heart complications, are you more susceptible? Are you a higher risk of contracting this virus?
You are at higher risk of dying from the virus and be having more severe cases if you have these comorbidities. So individually, just obesity gives you 3 times the likelihood of dying from COVID. But diabetes and heart disease and cancer and lung disease, asthma, COPD, and so forth, those are all risk factors for death from the virus. So those people should be using, the same sorts of cautions that everybody's recommending. They should be socially distancing. They should be staying at home. They should be limiting their exposure to the rest of the public. And if they have to go someplace, they need to be masking. They need to, keep themselves 6 feet from the other people that they're dealing with. And the other important component of this too is hand hygiene. They need to be washing their hands or using alcohol when they're touching buggies. When they're done shopping, they need to use alcohol or wash their hands to try to eliminate any direct spread like that. But yes, the truth is that these patients that have what we call comorbidities or other health problems predispose you to dying from the virus, and so they need to take special precautions.
All right, and we discussed the vaccine. The vaccine's working its way through the Mon Health system with the healthcare workers getting at least the first round, the first of 2 needed shots with the vaccine. Doctor, if you have heart complications, is this vaccine safe?
Yes. I mean, it has gone through extensive research to verify that it's safe for the public. I think it should speak to people when you have a medical staff, a lot of physicians, a lot of nurses, and healthcare professionals, and there is so much interest. As a matter of fact, people pressing to try to get the vaccine because it is what's going to help us, get to that light at the end of the tunnel. It is, getting your first vaccine, and then, 21 days later for the first one that came out here, you get your second vaccine, and within 5 days after that, it's conveyed the protection and so forth. So, I had my vaccine. I also, to David's point, have personal connections with it in the village down here. Both my mother and her husband and my in-laws all live down there, and they all had their vaccine, and very similar complaints, minor arm pain right in the muscle where you had it. To be honest with you, the four of them didn't complain at all about fatigue or any fevers or anything like that. Within 2 days, they couldn't even tell they had the vaccine. So it is a safe vaccine. There's a lot of misinformation out there. People need to not listen to the gossip and to what's being put online. There's misinformation about this goes into your DNA. It does not. There's tracking information. That's not true. There's always, when something as huge is happening, there's a lot of misinformation that comes out too, people trying to make names for themselves, and it puts people in danger.
As we bring David and Dr. Atkinson back into the conversation, for the listeners out there, if you think you have this virus, if you think you have COVID-19, what should you do? What are your first steps? If you have a doctor, if you don't have a primary care physician, what are the steps you need to take?
So this is David, and I'll jump in first. The first thing is contact your doctor. If you don't have a primary care doctor, we have multiple locations between us and WVU Medicine to get to primary care. Our Wedgwood offices are walk-in. You have MedExpress that have walk-in. You can be tested immediately. You can go to your emergency room. They will rapid test you just as easily. It's a little bit more expensive, depending on your insurance, to go to an ER. But a lot of it can be managed, like the flu, by being proactive with your primary care physician to begin with. The second aspect, and I'll put it out there, it's seasonal allergies, it's flu season, it's GI bug season, and a lot of the symptoms overlap each other. That's why it's so important to talk to your primary care physician to be able to help you. And if you have the comorbidities Dr. Warden talked about, we want to make sure they're managed with potential flu, which has been minimal at this point, as well as COVID, with your doctor, so we can get you at the right site of service at the right time as quick as possible.
Dr. Atkinson, anything to add?
Absolutely, Kyle. And I'll just add that if we've gotten ourselves to the place of getting past primary care and we're needing advanced attention, all of our EDs are open and ready to serve. So, again, the same processes like Dr. Warden talked about in the clinics, the rooms, the waiting areas, all meticulously cleaned. Everyone will be screened coming in, and our hospitals are safe to be able to provide care when needed.
Mm-hmm. And Kyle, if I can add real quick, we have, like everybody, reduced visitation. That does not mean no. It means we're just reducing the hours and the frequency of people to keep our providers safe, the patients safe, and them. We have 2 screening locations at our hospital, from the front entrance from 12 to 7, and then through the emergency room after hours. That's important for people to know. We're not saying no to visitors. We're just trying to be prudent. We also limit how many people can come in with a patient and or their loved one in the clinics for exactly the same reason that Dr. Warden said. Yes, we want your patient advocate and your colleague and your family member with you, but we also don't want to expose them nor to our caregivers to more than they need to. But that is not a no, but we're trying to be prudent. And let us know if you need something when you're coming to be able to help you and your family. If you're coming, of course, someone delivering a baby, heaven forbid you're dealing with someone dying or very, very sick, We will work with the families, but we do want to limit exposure.
Mm-hmm. And the hospital is not full. It's not full to capacity.
No, let me give you a sense, and Krystal will keep me honest. We do have a lot of patients here, but we have a lot of patients without COVID as much as we do have patients with COVID. Mon Health System employs 3,500 people across West Virginia. We have less than 30 that today are positive with COVID. So I want to put it in perspective. That's less than 1%, and every one of them we're watching very closely. We have one patient in our hospital ICU on ventilator associated with COVID today. That could change depending on those comorbidities and their acuity. But that being said, we work hand in glove with all the providers across the state and WVU Medicine related to how we can help each other take care of our patients timely. But to Krystal's point, if you're sick, come to your doctor. If you need to come to our emergency room, you're immediately roomed. So we are being as prompt as we can to get people with respiratory or symptoms segregated away from others so we don't spread it ourselves, but keep you safe.
Right. And again, if you need emergency care, if you feel you need emergency care, you can go to that website. You can check the time, the wait time for any of the ER rooms across the Mon Health system. We can give that out, www.monhealth.com, and the emergency room information is all there.
It is, but in emergencies matter, minutes matter. Just come to the ER. I could tell you we do immediate rooming. Unless we have an issue where they have to sit in the waiting room, which we minimize that and get you into a room, and family members are with them in their room or they have to stay in their car. But that being said, you're immediately roomed.
All right, Dr. Warden, just to sum things up, again, don't put off care, heart care. It's imperative. This is not the time to put that stuff aside. If you've got issues, see your doctor, get to the hospital.
We are doing everything in our power to make it safe for patients to come to Mon Health, both in the clinic and in the emergency department. And it's resulting in real numbers. The people are dying because they're not seeking care. They need to come in when they're having an emergency and not avoid coming to the hospital because there are dangerous outcomes that occur with that. The other part of this is we've just gotten through the Christmas holiday, and remember we went into Thanksgiving at a certain level of COVID and we came out with a spike afterwards. We're still in that spike when we got to Christmas, and now we're after Christmas, and it'll probably spike up, but we're headed next week into New Year, and as these spikes and we go into these time periods where people socialize, there's every reason to believe that the spike after New Year will be even higher. People really need to listen. They really need to socially distance. You can Zoom and you can do all sorts of things for your New Year's Eve celebrations. You can do it by phone. You can do all sorts of other things. Be inventive, but stay with your family in a small group. Stay isolated. Don't go to large parties. Wear your mask when you're out and about. It really is going to make a difference because the effect of the vaccine is, there's such a small portion of the population that's received it so far that the effect of the vaccine isn't going to be seen with these spikes. So just listen to what people are telling you. Limit your exposure to other people. Unfortunately, because everybody loves to be with family during the holidays, but this holiday is going to be a little different.
Yeah, it's hard not to be with your loved ones. It is. It's hard. It's hard not to be with grandma and grandpa and your extended family, but the vaccine is coming. We're going to get through this. It's just a matter of time. And you're right, guys. This is going to be a different Christmas. This is going to be a different New Year's, but if everybody works together, does what they're supposed to do, we're going to get through it.
I had a grandmother tell me yesterday that she's buying all of her grandchildren, children and grandchildren. She's buying them all facial lotion and that kind of stuff because when COVID is over, she's going to kiss them so much they're going to be chapped all over their faces. So just wait. You'll be able to do it at some point in time, just not right now.
All right. Final thoughts, David?
No, I'm going to wear my Fairmont State hat for a moment and just say all of our athletes that are COVID positive need to be cleared by a cardiologist before they can participate in their sports. So if we do it for our athletes, let's take and own our health care individually too.
That is David Goldberg as we take a break. David Goldberg, of course, the Executive Director, Mon Health Systems, and our other guests, Dr. Krystal Atkinson, Chief Nursing Executive of Mon Health Systems, and also Dr. Bradford Warden, Executive Director, Mon Health System Heart and Vascular Service Line and Chief of Cardiology. This is Mon Health Talk. We need to take a break. We'll come back and sum things up in a moment. But again, if you're looking to come to any of the emergency rooms across the Mon Health System, you can check out the wait times for those ERs, monhealth.com/MH/ER wait times. You can get the wait times for any of the emergency rooms across the Mon Health Systems. Also, if you don't have a doctor, you can check out Mon Health as well. Make an appointment, perhaps to be seen virtually. Back after this on WHAR.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Krystal Atkinson.
Mon Health Live continues for this Saturday morning. Again, we'll be with you every Saturday morning, 10 o'clock hour through the duration of this pandemic, pushing out the information you need to know, the latest case numbers and updates on the vaccine as they become available here in the coming weeks, and obviously what you need to know concerning the hospital, the Mon Health System, if you require care of any kind during this medical health crisis. Our guest today, of course, David Goldberg, Chief Executive Officer of the Mon Health System, and also we were joined in the first portion of this show by Dr. Bradford Warden. Dr. Warden was with us during the first segment. He's Executive Director of the Mon Health System Heart and Vascular Service Line and Chief of Cardiology for the Mon Health System. Gave us a lot of good information concerning heart health and patients, what they need to do during this crisis. Now I want to focus with Dr. Krystal Atkinson, Chief Nurse of the Mon Health System. Again, a lot of this basic information people have heard, people know, but now is not the time, Dr. Atkinson, for people to let their guard down.
We are continuing to see, not just in our county, but across the state, we're continuing to see the numbers of COVID cases rise, and a lot of those cases are now translating to hospitalizations. So again, as we talked last week, we really need to focus on the basics. I can't say it enough how important the masks are. First level of defense to be able to keep us protected and to keep those around us protected, in addition to social distancing. We need to make sure that we're washing our hands, and then we need to make sure that we're doing good self-care. We need to make sure that we're getting the appropriate rest and making sure that we're eating properly. But again, as we stressed again last week, the mask is our first level of defense.
Mm-hmm. Okay, well, let's expound on that a little bit, and we'll talk about the vaccine in a moment. But what about small groups? What about groupings of any size? Cold and the weather, it's keeping people inside, and that exasperates things. At least when the weather was good, people were able to go outside and maybe have some gatherings or have some activities outdoors. But Dr. Atkinson, that's just simply not possible for the most part here in December and as we head through the winter.
No, absolutely. And I think that we have to also think about, while we may not feel bad, as much as we love our extended family, we have to think about those who may have comorbidities, those who are a bit older, and that we could be an asymptomatic carrier and we could spread the virus to them. So really, when we think about it, this is a time that if there's ever a time to have this happen, the time now where we have so much technology, we need to utilize that. Whether it's Zoom, whether it's FaceTime, etc., we need to make sure that we're having virtual visits.
Okay, Dr. Atkinson, I understand there's some visitation changes. I'm assuming that's for the hospital to try and ensure safety for staff and for people who enter the facility. You want to go over some of those visitation policies?
Yes, absolutely. We really haven't changed a whole lot to our visitation policy, with the exception of we decreased our hours from 8 a.m. to 7 p.m. to 12 p.m. to 7 p.m. We are still focusing on having that one consistent visitor that comes in with our patient. Of course, there's always exceptions. If we have people that have special needs and they need to have somebody with them during a visit, coming to the ED or for testing, of course we'll make those exceptions. But all of our information, very specific for all of our units, can be found on monhealth.com/coronavirus.
Okay, what about what about procedures? If someone is scheduled for a same-day procedure or an outpatient procedure, what's the policy there in terms of them being accompanied into the hospital?
Yes, the same policy is in effect. If they need an individual to accompany them, they're more than welcome to be able to bring them. Again, we're trying to err on the side of caution for everyone, and if that's not needed, we appreciate just having the patient in the facility.
That is Dr. Krystal Atkinson, Chief Nursing Executive at Mon Health Systems. We also thank our other guests, David Goldberg, as well, and Dr. Bradford Warden joined us during the first segment of this show, the Chief of Cardiology at Mon Health Systems. Mon Health Live, and again, we'll be back, of course, next week with another edition of this program. All right, final thoughts, Dr. Atkinson.
Just echo everything that's been said. We are glad that we've gotten safely through Christmas. Let's continue to be vigilant, and let's just try utilize our technology to celebrate the new year.
Excellent. Guys, great information, tremendous information. You're doing a fine public service, and we appreciate you joining us this morning, and we'll reconvene next week.
Let's go Mountaineers.
Very good.
Thank you all.
That is Mon Health Live for this Saturday morning, 104.5 FM, 1440 AM, WAJR.